There are 5 simple abilities that predict how well you'll age better than almost any lab test your doctor runs. And you can check every single one of them yourself, in your own living room, in well under an hour, with nothing more than a stopwatch and a bit of open floor space. I'm going to walk you through all 5, what each one reveals, the real research behind it, and this is the important part, how to actually improve any of them if you fall short. None of these are fixed traits you're stuck with. Every one of them responds to training, at any age, which is honestly the most encouraging part of all this once you understand it. Before we start, comment which of these 5 you're most confident about and which one you're a little nervous to try. I read these, and it genuinely shapes what I cover next. Here's why these 5 specific things matter more than most people realise. Each one requires several of your body systems, muscles, joints, balance, cardiovascular fitness, coordination, to work together at once. That makes each one a kind of full-body stress test disguised as something simple. When one of these abilities starts slipping, it's often the earliest visible sign that something's changing. Well before it shows up on a standard medical test. That's actually what makes these 5 so useful compared to a typical lab report. A cholesterol panel or a blood sugar reading tells you about one system in isolation. These 5 tell you how well your systems work together in real time, under real demands, which is a genuinely different and in some ways more practical kind of information about how you're aging. The first is your walking speed. Researchers genuinely treat it as a vital sign, alongside things like blood pressure. Walking efficiently requires your heart, lungs, muscles, joints and balance system to coordinate in real time. So when gait slows, it's often the first visible ripple from something else changing underneath. Research out of the University of Pittsburgh, tracking over 34,000 older adults across 9 pooled studies, found that walking speed was strongly associated with survival over the following years. People walking at a comfortable pace of roughly 3 feet per second or faster consistently showed better health outcomes than slower walkers, even after accounting for other health conditions. What made this research notable is that gait speed alone predicted survival about as accurately as a much longer list of traditional factors combined: age, chronic conditions, smoking history, blood pressure, and more. The genuinely good news: walking speed is trainable. Regular walking that includes intervals of a faster pace has been shown to measurably improve it over time. You don't need a formal program, just deliberately picking up the pace for short stretches during a walk you're already taking. Second is grip strength, a surprisingly powerful stand-in for your overall muscle strength, and what researchers call physiological reserve, meaning how much physical capacity your body has in the bank. It works as a proxy because grip strength correlates closely with strength in larger muscle groups throughout your body. It's easy to measure precisely, which is part of why researchers lean on it so heavily. Low grip strength has been linked in research to higher fall risk, slower recovery from illness or surgery, and reduced longevity. It's one of the cheapest, simplest tests in medicine. A handheld device called a dynamometer, something many physical therapy offices and some gyms have on hand. And it tells us a remarkable amount for something that takes seconds to measure. The encouraging part: grip strength responds well to resistance training. Carrying groceries, using resistance bands, or basic strength exercises twice a week can improve it at nearly any age. And unlike some fitness markers, meaningful improvement can show up within a matter of weeks of consistent effort. If you don't have access to a dynamometer, there are two reasonable at-home substitutes. One is a simple dead hang, gripping a sturdy pull-up bar or secure doorframe bar and seeing how long you can hold your body weight, feet off the ground, before your grip gives out. The other is a carry test, picking up two moderately heavy grocery bags or similar weights and timing how long you can carry them before you need to set them down. Neither is a clinical measurement, but both give you a genuinely trackable number you can retest over time, the same way you would with the other 4 abilities on this list. Third is cardiovascular fitness, how efficiently your heart and lungs deliver oxygen to working muscle, often measured as VO2 max. A large study out of the Cleveland Clinic, following over 122,000 patients who underwent treadmill testing, found cardiovascular fitness was one of the strongest predictors of long-term survival. Researchers have identified ECA. In that analysis, the gap in mortality risk between the least fit and most fit groups actually exceeded the risk difference tied to smoking, diabetes, and coronary artery disease. Sit with that for a second. Being unfit was a stronger predictor of dying earlier than having heart disease itself was in this data set. That's a genuinely striking finding, and it's part of why cardiovascular fitness gets treated as such a central marker in this kind of research. Not because it's trendy, but because the data keeps pointing the same direction. The relationship kept improving with no observed ceiling. The fittest people in the study, for their age and sex, had consistently the lowest mortality risk of anyone measured. The logic tracks. A body that delivers oxygen efficiently has more reserve to handle illness, surgery, or simply an active life. This is genuinely one of the most trainable things on this list too. Regular aerobic activity, brisk walking, cycling, swimming, anything that consistently raises your heart rate for a sustained period, measurably improves it, even starting later in life. And the research is consistent that it's never too late to see real gains here. If someone you love has been told their fitness doesn't matter much anymore at their age, send them this video. That's simply not what the research shows. Every study we've covered so far found real, measurable improvement possible well into older age, and it's worth them hearing that directly rather than assuming decline is a one-way street. Fourth is balance, tied directly to one of the biggest fears people have about aging, falling. Balance depends on your inner ear, vision, sensation in your feet, and muscle strength, all communicating with your brain continuously. And it's often the first of these systems where decline becomes noticeable, sometimes years before it shows up anywhere else. A person can walk at a perfectly normal pace and still have a meaningful balance deficit, which is exactly why this deserves its own dedicated check, rather than assuming a good walking speed covers it. A serious fall in your 70s or 80s is one of the leading causes of lost independence, which is exactly why balance training, standing on one leg, Tai Chi, basic stability drills, has such an outsized impact relative to how little time it takes. A simple way to track it yourself. Time how long you can stand on one leg with your eyes open, holding onto a counter or chair nearby the first few times for safety. Retest every few weeks, and you'll have a genuinely meaningful, trackable number. The fifth is getting up from the floor without using your hands or arms. A real validated research tool called the sitting rising test. It requires leg strength, core strength, balance, flexibility, and coordination simultaneously, which is exactly why it's such a useful single snapshot. It's genuinely hard to fake a good score on this one. A well-known Brazilian cohort study following adults over several years found that people who couldn't perform this movement without support had a meaningfully higher risk of death in the years that followed compared to those who could. The relationship held up even after accounting for age, weight, and other health factors. It's one of the more striking findings in this whole area of research, precisely because the test itself is so simple and takes about 10 seconds to attempt. If you can't do it today, that's genuinely not a verdict. Like everything else on this list, it improves with practice. Working on the individual pieces, squatting, kneeling, pushing up from a low position, rebuilds the strength and coordination the full movement requires, and most people see real improvement within a few weeks of practicing the components a couple times a week. I think about people I hear from in a situation like this often. Let's call her Diane, mid-60s, who could walk fine and had decent grip strength, but genuinely couldn't get up off her living room floor without grabbing the couch. She tried the sitting rising test after a friend mentioned it, got stuck on one knee, and admitted afterward it was the first time in years she'd actually tested a physical skill rather than just assumed she still had it. Most of us simply never end up on the floor in a way that would reveal the gap until it matters. She started with simple squats and kneeling practice a few times a week. Nothing elaborate, just consistent. A few months later, she managed the full movement, unsupported, and said the real surprise wasn't the floor test itself. It was noticing she'd stopped avoiding sitting on the floor to play with her grandkids, something she realised she'd been quietly doing for years without ever naming it as an avoidance. One honest caveat: if you have a known balance condition, joint replacement, osteoporosis, or any condition affecting your bones or joints, talk to your doctor or a physical therapist before attempting the sitting rising test or balance drills like single leg standing. These are genuinely useful self-checks for most people, but they're not risk-free for everyone, and a full while testing yourself defeats the purpose entirely. A physical therapist can also show you modified versions that build the same underlying capacity more safely, so you're not skipping the benefit, just adjusting how you get there. One thing worth answering before we wrap up: what if I'm weak on more than one of these? That's genuinely common, and it's not a reason for alarm. These 5 systems overlap more than you'd think, so improving one, like cardiovascular fitness through regular walking, often quietly helps another, like balance, simply because you're spending more time upright and moving. Pick the one that concerns you most and start there. The others tend to follow along more than people expect. Here's what I'd actually do. This week, test all 5. A comfortable pace walk you can time over a measured distance. A grip check using a dynamometer if you have access to one, or the dead hang or carry test if you don't. A brisk walk or bike ride to gauge how your breathing responds. Single leg standing with eyes open near something sturdy to grab if needed. And the sitting rising test if it's safe for you, given your own health history. Write down roughly where you land on each one, not to judge yourself, just to have an honest starting point. Wherever you're weakest, that's where to start training first, not everything at once. Trying to overhaul 5 things simultaneously is a good way to burn out in 2 weeks. Picking the one that concerns you most and working on it consistently for a month tends to actually stick. None of these 5 numbers are fixed. Every one of them responds to consistent ordinary effort. Walking, carrying, standing, squatting, the same kinds of movement your body was built to do in the first place. That's genuinely the whole point. Independence isn't decided by a lab report sitting in a folder somewhere. It's built and maintained through capability. You can keep training at any age, starting from wherever you actually are today, not where you wish you were. Everything in this video is general health education, not personal medical advice. If you're managing an existing condition, please talk with your own doctor or physical therapist before starting new exercises. This content is meant to work alongside your care, not replace it. If this was useful, subscribe and hit the bell for more like it. I'll see you in the next one.